Hey doc, welcome back for another question in immunology. I chose this specific question because it's a little tricky. So let's go through it and I'll walk you and navigate you through the little twists and turns and show you how tricky it could be, especially this one. So read the last three lines like we always say, last three lines. There is pitting on the nails on all fingers. Okay. Therapy with a high potency topical medication that inhibits NF kappa B and phospholipase A2 is begun. Long-term use of this agent, which is a high-potency topical medication that inhibits this stuff here, is most likely to result in which of the following. So they won't give you the drug, they're just telling you the MOA and saying too much of this will cause what in the patient. Let's go to the top. Now, ideally, if you know what this is, well, this should be steroids, right? NF kappa B inhibits phospholipase A2, and you have the arachidonic acid pathway, which we did in a previous question. And you can appreciate more of why we give steroids to patients and why it works many times. So we also need to know side effects, right? So you're not meant to take steroids for too long. Why? That's the whole question. Let's go to the top, read what else we have, and go from there. A 43-year-old woman comes to the physician with a 2-week history of neopruritic plaques on the scalp and extensor surfaces of the elbows and knees. 10 years ago, diagnosed with psoriasis. Medication is topical calcipotriene. Physical examination shows well demarcated, symmetrical, erythematous plaques with silvery scales. So, we have to understand that they're talking about steroids. Steroids has this MOA, fine. Now we're like, oh boy, what do we answer? Long-term use of steroids it causes what? We have dysplastic nevi. This actually has nothing to do with steroids. Corticosteroids, if it's systemic steroids, it can increase the chances of getting cutaneous squamous cell carcinoma, basal cell carcinoma, but nothing dealing with this, so this is out. Non-blanchable pinpoint macules, this is more for thrombocytopenia, this is out. Decreased sebum production, well, this actually is increased, not decreased. So in steroid use, chronic steroid use, it actually can get increased production, so that's out. So you see how they play the words instead of increased to have decreased. I mean, sometimes you might trigger a certain phrase, like, oh, I know I read that somewhere. Yeah, but unfortunately it's increased production, not decreased production. So be careful with that. Down to 2. Dermal collagen loss and hair growth on upper lip. Now, chronic steroid use can cause hair growth. However, this is topical, not systemic. Topical, right? Not systemic. 2 different types of administration, and because of that, different adverse effects. So hair growth on upper lip, yes, but not usually on the upper lip. It's going to be where the application is. So again, it's teaching you how to understand the material. It's very tricky at times because under stressful events, I keep mentioning this to you, now we're relaxing, enjoying each other's company. I have my iced tea over here. You have perhaps your drink or water by your side. So you're more relaxed. But on exam day, or maybe you're taking an assessment test, you're stressed, right? So we have to read faster. We have to connect faster. We have to make a decision faster, and that's stressful. That's why we always practice this way. First, practice, enjoy our time, no stress, understand the steps, connect the dots, and then improve as you go. So this would not be the answer because upper lip, we mentioned, usually hair growth is an adverse effect or something can happen, but it's typically where the application is. So showing you how to knock out the answer choices literally will strengthen your test taking skills and also increase your score, because without even trying, well, there's the answer. So again, when you're working on these questions, it's important to understand that it's nice to go in and see the case and see the patient in the hospital, answer these questions and click the answer and go. And I hope you do. But when you're practicing, you have time to practice. You need to strengthen everything. In this case, we know with steroids, they give it away by inhibition of NF kappa B. Memorize this, write it down somewhere, know this. And phospholipase A2. If you go one by one, look at this, 10%. This actually is chronic systemic corticosteroids associated with increased risk of cutaneous, squamous cell, basal cell. Not like this at all. And we talked about these two. This is for thrombocytopenia. This is actually increased, not decreased. And hair growth, yeah, there's hair growth, sure. Chronic steroids causes hypertrichosis, particularly in the vellus hairs. However, adverse effects limited to the area of application. So typically you're applying it in the elbows and knees, not in the upper lip. And I bring this to your attention because this content right here, reading the inflammation, understanding the inflammation, understanding why we give steroids is huge. And knowing steroids, knowing the MOAs, knowing the adverse effects, being able to apply it, knowing that NF kappa B, which maybe you haven't seen in a while, maybe it wasn't on your radar, is part of why steroids do what they do, right? So you need to know that information. And if you take just 5-10 minutes of your time, read the explanations, you'll be able to strengthen, understand more of every single topic you're reading, every single drug, adverse effect, MOA, and so on. So please take your time with these questions. They're very, very important, especially with immuno, micro, and biochem. These are little details that they expect, they hope that we forget. And because we hope, we get it wrong. And we need to know these details, right? Practice, keep practicing, keep reading, reviewing, and I promise you'll do very, very well. All right, Doc? See you on the next question.